Because of the HUD smoke-free housing rule, residents are just able to live healthier lives, and we were able to create that environment for them. The U.S. Department of Public Housing and Urban Development set a policy in place that was scheduled for July 30th, 2018, and all of the public housing authorities had to be smoke-free at that date.
Kentucky has the highest rate of smokers in the United States. Our combined efforts with the American Lung Association and Mental Health America is to improve the living conditions and support the smoke-free HUD rule for everybody, including people with behavioral health conditions. Folks who have a mental illness smoke at a higher rate. They smoke more frequently than others. Our low-income residents, a lot of them have a lot of trauma in their lives, ACEs as we say, adverse childhood events in their lives. So we know that mental health issues exist in that population just by nature of them being in those housing developments. We were working inside the housing authority trying to help folks quit smoking and encourage people to understand mental health and smoking and how those things interact together.
The American Lung Association was able to provide resources, templates, toolkits to the public housing authorities to help them get the policy started. We also were able to provide cessation to the residents who were ready to quit.
When we went into the residents in Louisville, one of the things that we heard from them is a fear about being targeted for a habit that has been in their generations. You know, they've had their grandparents grew the tobacco and smoked it, right? They were like, I feel targeted by this. I feel like it's pointed at me. And even residents that don't smoke felt like it was targeting those folks that smoke.
So we need to bring a positive reason for this happening. So the Lung Association was able to provide talking points for the managers to the residents to explain why this was happening and that it wasn't a negative thing. The rule is so important because secondhand smoke is getting into all the units. So those people who weren't smoking were still inhaling the 7,000 chemicals that are found in secondhand smoke.
We know that smoke travels, and a lot of these places are high-rise buildings, multi-unit facilities that share air from one place to the next. There might be a kid in the next door apartment. That kid is getting harmed by someone, their neighbor, smoking. When we came in with education about secondhand smoke and even third-hand smoke and how that can make a whole building sick, we really changed that narrative. We turned it around. I mean, it wasn't targeting a single person, it was investing in the health of everyone who lives in those facilities. The American Lung Association had all this great information on tobacco and smoking and how it affected everyone around us. We were able to add that mental health expertise to hit this very specific population.
Partnering with Mental Health America helped us to have more resources, helped us to design more strategies, and just gave us a bigger voice.